Many here are still having flashbacks to those heartbreaking days, and there are haunting reminders of what was lost when they walked through the doors. They're hoping for more help with their mental health.
We were the ones on the floor having to tell family members that they couldn't be here for their loved one's last breath. We had to hear the family cries, and we were holding their hands while they were passing.
Emotions flow as Caitlin Clark reflects on the horror she witnessed working as a nurse at the Holyoke Soldiers Home during the height of the pandemic. She says the stress of witnessing veterans die, the lack of support and supplies, took a serious toll on her mental health.
I was just angry, and I was hurt, and I was confused, and I felt like, how could this happen? Even still now, I have my moments. It's hard. If I didn't have a 6-year-old daughter, it's scary.
For Caitlin and coworker CNA Joe Ramirez, who became extremely ill with the virus, those dark thoughts are a common struggle in the wake of immense loss. The 77 veterans who died from COVID were like family. Photos and empty rooms are haunting reminders.
As I look in rooms or I go through, paperwork, or I see a picture of, one of my veterans that I took care of, it just brings everything back.
From the side of the refrigeration trucks where veterans' bodies were stored, to being reprimanded for wearing PPE when COVID symptoms first surfaced, there were many emotional and stressful triggers. Texts between a handful of staff we obtained show the mental anguish mounting as veterans began to pass away. 2 guys have passed on 2 North within this week. Staff on 1 North are having a terrible time dealing with so much grief. Lost 4 more vets, so now that's a total of 6 in just 2 days. The CNA who witnessed all those deaths and had to body bag them too is overstressed. She's young and is having a hard time dealing with all this. We didn't have enough stock morphine for dying vets. There's a refrigeration truck on generator parked near outpatient. Just heard it's for the bodies. Our morgue is not big enough. Can't stop crying.
I still have anxiety level when I leave. When I'm trying to leave, I have that hard time leaving my house to come here.
I felt I lied. I told them they'd be back soon.
Feelings of guilt weighed heavily on Caitlin. In early April, she was told to pack veterans a few days' worth of belongings for a temporary move to a local hospital.
And some didn't make it back. It was crazy. It was madness. It hits hard.
At least 44 CNAs, nurses, and other staff left their jobs since the onset of the pandemic.
And what the state have allowed to happen is going to have effects on families, the veterans' families, the veterans, and us as the workers ourselves for a while.
And a few employees had to use their own time to attend an intensive program to help them cope with what they witnessed. The state did provide mental health services here in the past, but they're bringing back more beginning this week. Kathy Curran, 5 Investigates.